Yes, be ready now. Please don't do anything. You have to listen and you have to read. Certain words will be very. John, please sit up straight. Very tough. What all things you are able to read, you can read. Others you can just avoid, omit it. Okay, now we are going to start. You know that still that virus, coronavirus, is here around everywhere. So you must be very careful. You must, as I told you, you must wear your mask wherever you go. Anyone comes from outside to your house to visit you, you must wear mask. First of all, if it's only for your parents, those visitors are coming to meet them, you don't come out of your room. Children and old people will be affected. Okay, children, we'll start now. Uh, please get ready. In between, no disturbance. Adonia, how did you join the class? Somebody else? What's your dad's name? Because I don't know. Because I don't know. Some people asking for entry. I just gave to admit now. Actually, we are not supposed to do it. You have to enter through your school ID. Okay. I don't know who's that. I don't know. What's your daddy's name, Adonia? John. I can't remember. Some Christian only. But that's what I gave. I don't know. Next time you just try to come through your school ID, whoever it is. Even this Roshan, I think, one person. No. Anand Kumar.
I came to my ID only.
Yeah, who's that? Anand Kumar, whose father? Anand Kumar. Somebody else. Then I forgot that Adonia, some name. I don't know who's that. Okay, now we'll start our class. Just have a look at all the slides. Now, please be attentive. Don't play around. Akilan, turn off your mic.
Ma'am, excuse me, ma'am.
Yes,
I'm Akhil, mother, ma'am.
Yes, ma'am.
I sent the assignment, ma'am. You received, ma'am?
Now this time, let me see.
Yes, ma'am. Yes.
Okay, I'll just see. Okay, ma'am, I'll see. Ma'am, he has to, actually he knows everything, but still he will tell, I don't know. He's just going away. So yeah, he has to be in class, ma'am, for his internals. Okay, ma'am. Thank you.
Okay, sure, ma'am.
Thank you. Now, just see. We know you no need to read. You have to only see to it. COVID is an infectious disease. So that means 1 minute, easy to spread. See, we can't wait for it because it grows hands. 1 minute. 1 minute. Reason it is called as SARS-CoV-2 coronavirus. Understood? Back. Now, 1 minute. I will just read. Before the out. No. 1 minute, children. Because it's a video, it goes on like we cannot stop in between. Anyway, we'll see. It's originated in Wuhan, China. There was no information about this virus. And people are just trying to find. Okay. Excuse me. Who's that? Listen. So we are just praying to find the proper medicine for it. Now, the oldest common ancestor that has been dated as, you see the picture, okay, as far as the 9th, it goes very fast. 9th century, some studies published in 90. Actually, you don't need to see all these children. You have to see the picture and you have to know what it is. That's all. Okay. Now, see all these names you won't be knowing, but still for everybody, for higher class 1 to 10 standard, will be showing like this. Okay. Now, this is the history. So we don't know exactly from where it started. Like, it's not that we don't go very deep. We just want to see the precautions. Previously called novel coronavirus, new strain of a virus that first emerged in Hubei province in China late in 2019. Actually, 1 year is over now last week. And a large family of viruses and can cause the common cold in humans. That symptoms, very bad cold, wheezing, then after that headache, fever. Okay, children, hope nobody is having in our midst like among ourselves. We'll see the next one. How to prevent people surfaces. This disease can spread from person to person through small droplet. It will come back, children. Wait. Small droplet from the nose or the mouth when the infected person coughs or inhales. Did you understand what it is? Actually, a small droplet from the nose or the mouth. I'm just bringing it back, okay? When the infected person cough or, listen, sneezes or exhales. So you must be very careful when you go near the people. Surfaces. These small droplets land on surfaces, which means any person that touches these surfaces, and then their eyes, it will come, and then their eyes, nose or mouth can become infected. Okay, did you understand, children? So you must be very careful when you go to any person. Okay, when you go to any person, you must be very careful, because when they sneeze or cough, the tiny droplets will just spread. That's what all are wearing mask. Okay, we don't know how many of them got. So you must be very, very careful. And then their eyes, nose, or mouth can become infected. Infected means you'll be getting it. You must not use such big words, but anyway, we will just see what you can get from all this. These small droplets land on surfaces, which means any person that touches these places where the infected people come and sit or go away from there, any of you go and touches any person. Okay. Now, many people infected with COVID-19 show mild symptoms. Sometimes there is no symptom, especially during the first stages of disease. Let it come back. Please, we find it very difficult to show all this, so you don't turn your mic and talk in between, please. And stages of the disease. We are just going to see. During the first stages, they have mild symptoms. Then after that, just watch. Still catch the disease from an infected person who only has a mere cough. Now after this it will come, children. Then you will be able to see that. See, children, mere cough means not very bad cough, but still does not feel ill. That is the symptom. Okay, you must be very careful. If somebody has cold, mild cold, or mild cough also, those person will be affected sometimes. We can't say. Even you have cold or cough, don't think you got COVID. Okay, that's because of the weather or climate. Okay, now we'll see the next one. How they tested, oh my goodness. Hope all are safe over here without being infected. Let's see the next stage. Only has a mere cough and does not feel ill. Next one. See the symptoms. Eyes, tired, completely tired, without energy, dry cough, constant coughing, temperature. See there. We have to see once again the same. Breathing, difficulty in breathing. Very bad. You won't be able to open. Very bad breathing. Okay. You won't be able to breathe. Let's see the next one. You can just have a look at this. Let it come, children. You won't be able to read it because we are going a little fast over there. That's what ma'am is showing. See the headings: tiredness, dry cough, high fever, difficulty in breathing. All these will, if you have all these symptoms, at once you have to see a doctor. You have symptoms or have been an infected. See here. Step one. Step one. 1 minute. Children, just wait. Step one. What to do if you have symptoms or have been an infected area. Call the designated phone number, because already phone numbers will be given everywhere. Okay. Then you will be given a home test over the phone. Okay, how to get rid of all this? You must know all the precautions. What to do if you have symptoms. Again, patiently wait for the results of the test. You have to wait for the result. Follow the instructions provided by the doctor. You cannot leave simply as it is. 80% of the people recover without needing special treatment. Okay, already 80%, only 20. What happens is, small children below 10 years and people above 65, 60 to 65, these people, they won't have that immunity power. Okay, that's what we tell you to eat good food. Only eat nice food, nice vitamin. All vitamins you have to take. Doctors say that you have to use at least 2 eggs you have to eat every day, daily. Okay. Preventive measures, how to prevent all this. How to prevent. Do not work. Yeah, you cannot take antibiotics, because children, when we are sick, when we go to hospital, they give one tablet for the sickness plus antibiotic, because to withstand, but it will not work. Okay, antibiotics you must. Even if now when we go to the medical shop, they'll tell this tablet is not available because of this COVID. They don't sell it in the medical shop. Okay, all the chemists, they'll tell us they will not, because anything happens, they will be blamed. Okay, no antibiotics for this. Only big people will know, small children won't know all this antibiotic and all that. Protecting yourself and preventing the spread of the disease here. How to wash hands. Wash your hands with an alcohol-based sanitizer. Sorry. Or because it's going very fast, ma'am has to wait 1 minute. Okay. You have to use Each one is shown separately over here. Hands with. Let's wait, children, let's wait. After this, just have a look quickly, then one by one we'll do. First one, how to wash. Soap and water. Second one, keep a distance, 1 meter. Not to touch your eyes. Cover your mouth. Yeah. If you have any problem in breathing. And whatever the nurse or the doctor say, you have to, the nurse says or the doctor says, you have to listen. You can go through this video later. See, public gathering, all the functions. Steam twice in a day, wash vegetables, use safety gloves to handle money, because when you're getting change, drink hot water often. Often you have to drink hot water. Once again, this will show, it's very nice. At least that was, yes, children. Whoever's going for big functions, when many people are gathered, they are carrying this virus and coming home. So better be careful. See the vegetables, you have to wash everything. When you buy from a greengrocer, the things, a vegetable seller, you have to wash. See, safety gloves, when you touch money, anyone gives the change from the shop. So what you have to do, avoid all this. Elderly person is there to do all this in your house. Then steam. Then you can even wash your face with hot water. After that it will come, because it is little bit informative for y'all. No need to read all that. That action itself you will understand. Action. Okay. Let us see. See that best not to touch your eyes, nose and mouth often. Follow the direction of your national local health authorities, that is nurse or a doctor. Any difficulty in breathing, at once you have to inform your parents. Now all this I know by now. Drink hot water, yes. That kashayam what they used to give in school, even it's available outside, you can have. Please, don't go for very good taste. Okay? Yes. Protection measures, people that are in or visited infected areas. Stay home if you do not feel well. If you feel, see how fast it's going, but we'll read. Oh my God. If you have headaches like fever and a running nose, that is. Okay? If you have like that, you don't go anywhere, you stay at home. Don't make noise, fear. In between, you don't come. If you need to go out, you buy food or supply anything, wear a mask to minimize. Children, very hard for me to come back to this to see whether you all are attentive. So please behave yourself. If you need to go out, you have to wear a mask. If you have difficulty in breathing, go to a medical advice. Then call your provider and inform them any recent travel. If you are gone anywhere and come back, you have to be in quarantine. Okay. All these you have to listen to all this advice. Otherwise, you will be sick. How to use a mask. Before wearing a mask, after removing the mask, wash your hands with sanitizer. Cover your mouth and see how to cover nose with the mask, and make sure the mask is firmly pressed against your face. Let's see once again the same. Okay, just wait. See how to wash hands nicely. Each finger you have to take it out. Cover your mouth and nose with the mask. From behind, you have to remove. Don't touch inside. Okay. To reduce the risk of coronavirus infection. See there? One by one. Keep your house clean and well sanitized. Clean. Never forget to carry hand sanitizer when there is need to go out. Use digital money transfer for all bill payment. Again, I'm showing. Prefer online shopping during the festive season. Here, nobody is listening. Cover your mouth and nose with your bent elbow. See how it's done. You don't have a mask. See that? Once again, you just have a look. Only see the pictures. No need to read. So you can get it. Children, you have to go through it because you have 2 days holidays. You have to go through it. Don't think that it's waste. It's very, very useful. Virtual hug. See, stop all this. It's not kindness when you see your grandfather, not that in your house, children. And some people, those whom you know, when they enter, avoid hugging them for some time because of this virus. You have to be very, very careful. Okay, no one should get angry for all this. It will help you not to spread this virus, corona. Stop the spread. See, our distance makes us stronger. Yeah, stand together. No. Standing together, no need. Please keep a distance. 1 minute. To fight against COVID, practice yoga. Stay home. Don't go out. See how they're doing. Relax with good music, my. Pray and don't panic. Anything happens, pray to God. God is there for you. Okay? To fight against COVID, you can only, you must be doing only relax yourself with good music. Okay? Stay home. Don't go out. Do exercise at home. Stop playing. Like if you go out also to play, keep distance. See how it's shown, maintain social distancing. See how they are going for a walk. They are not playing. When you go for a walk, you just keep social distancing. Okay. One minute, wait. I just want you to see when the video stops. No, it's better for you to see all this. After that, you can talk, not now. Maintain social distancing, practice yoga, relax yourself with good music, pray and don't panic. Now let's see the next one. Control virus, save lives. That's all we can tell you. Now, this one will not run away, don't worry. That was a video given from the school for everybody to watch how to hand rub. Just look at this. When you go to hospitals, it will be there, this picture. Rub hands for hand hygiene. Wash hands when visibly soiled. See here, 20 to 30 seconds. Apply a palmful of the product in a cupped hand. Just pour it, covering all surfaces. See there, hands palm to palm. You just do it. This is the way you have to, not that simply pour water and put some soap and run away. Neatly. Now see the third one. 1A, B, you know how to pour the product on your palm. Second one, you just rub it both. Third one, right palm over left dorsum with interface fingers and vice versa. Any way you can do, like going up and down, just turn it. You know, no children how to rub hands, palm to palm with fingers, interface. See that? All these you watch, children. It will be useful. Backs of fingers to opposite side. That is palms with fingers interlocked. See there? Rotational rubbing of left thumb clasped in right palm and vice versa. See there? The thumb alone. What all precautions, children? And are you doing it? No, no. We are just, even I don't do it like this. I think after seeing this, I may start. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Left hand in right palm. Once dry, your hands are safe. Take time. Don't tell that you don't have time to do it. Take time for everything. We'll go to the next one. Tips to reduce risk of infection. Wash hands often. Use soap and water or alcohol-based hand rub. Soap and water is very, very useful. Okay, we advise that. It's advisable. Cover your mouth and nose if you cough or sneeze with the inside of your elbow, because suddenly if you sneeze, you won't be able to wear mask and walk about. Use your elbow. It was shown before. Okay. Don't get close to anyone who has cold or flu-like symptoms. Better to be away. Go to the doctor if you have a fever, cough, or feel that is difficult to breathe. B-R-E-A-T-H-E must come there. Okay, if you go to the market, don't touch animals or anything in the area they stay. Not only the market, when they go outside. Okay, don't touch. How to wear a non-medical fabric mask safely. See, all won't be medicated ones. It's too small. Clean your hands. See the pictures. Inspect the mask. Your face without leaving gaps on the sides. Cover your mouth, nose, and chin. It's too small for you to read. You can read it later. Avoid touching the mask. Don't touch too many times. Before removing, before wearing, you have to use. Clean your hands. Okay, with any lotion. Remove the mask by the straps behind the ears or head. Put the mask away. Some mask will be used and thrown. You have to throw it off. Other one you can. It is washable. Okay. See, if it's damaged, you don't use it. Do not wear a loose mask. No use of wearing mask then. Okay. Under the nose, like fashion, don't do it. People within just within 1 meter, you can't stand in front of somebody and remove your mask. Some outsiders. Use a mask that is difficult to breathe through. You won't be able to breathe. Dirty or wet mask, never. Do not share your mask with anybody else. Okay? So you must be very, very careful now. Okay, children? Thank you. Be smart. You must be smart enough to do all that. Let us see now how many are there watching. See, Present slept. Present, did you sleep now? No. Hope, children, this was very useful for you. I think so. Hope so. Surely it will be. It is very useful. You have to go through it. Okay. This is a part of our education. Okay. Not only studying this and that. You must know. You must know. Okay. You must know how to uh, use a mask, how to keep a